and read the writing task. You are a registered nurse at the dementia-specific unit. Using the information in the case notes, write a letter to dietitian. Address is given. Request the dietitian to visit and assess Ms. Smith's swallowing function and nutritional status urgently due to a high risk of aspiration. Right. The writing task indicates the urgency of the letter. So let's see the very recent event given in the case note. 14th of October. It was yesterday. Episode of talking on a piece of food. Food not chewed properly. She suddenly turned blue, grabbed the throat with both hands and coughed. The piece of solid food was removed, followed by some nursing assessments. Right. Now let's go up and see who the patient is. Patient's name, Ms. Julia Smith. Date of birth is given. She is a new resident of dementia-specific unit. She's single. These things are not important. We can avoid that. Coming to her medical history. Ischemic heart disease since 2012. Takes nitroglycerin patch daily. That's not important. We can avoid that. She had a stroke in May 2018. We'll inform this thing to the dietitian. After stroke, unsteady gait. That's not important. We can avoid that. In 2018, she was diagnosed with severe dementia, able to understand simple instructions only. Yes, this is important for the dietitian to know regarding her dementia, confusion, and disorientation. She has a diabetes mellitus, and she's on a diabetic diet. Definitely, we'll inform this. Osteoarthritis? No, we can avoid that. Weight gain of 10 kg over the last 5 months. Her current weight. She experiences chronic constipation and takes laxative as required. No allergies to medication or food. No teeth. She has entire upper or lower dentures. But she refuses to wear due to her confusion and disorientation. Increased appetite. Usually eats full portion of off-food meals daily and also goes into... that's not important, we can avoid them. We will just inform that her appetite has increased. Coming to the social history, let's see if we can find any relevant notes. No friends, lack of interest, emotional dependence, non-smoker, no use of alcohol. No, nothing. We will not include any of them. Some recent nursing notes. Chest infection. Fine. Which was noted last month. Occasional cough. Alright. Episodes of shortness of breath with increased respiratory rate. No, that's not important. We can avoid that. Sporadic throat clearing after eating yogurt. Yesterday, she had an episode of choking on a piece of food. Some nursing assessments. And she has no complaints. The vital signs are normal. Right. So let's write this letter. So, as always, we will write the recipient's name. Recipient's name is not given, so let's write his designation, the dietitian. On to the next line, we will write the address. Department of Nutrition and Dietetics. We will leave a line and write the date. We'll leave a line again. Let's write the salutation. Dear dietitian. We'll leave a line again. RE section regarding Ms. Julia Smith. We put a comma. Date of birth. And let's write the introduction. Now, how my introduction should be. In the case note, it is given about her high risk of aspiration. So we will write this thing in the introduction, and definitely the purpose. So let me start like this. I'm writing this letter concerning Miss Smith, who is at increased risk of aspiration. She requires urgent assessment of her swallowing function and nutritional status. And that's done. Now, for our first body paragraph, let's write about the recent event. Ms. Smith choked on a poorly chewed piece of food yesterday. Let's put a full stop. She has no complaints and her vital signs are normal. Now we make a new paragraph to write some relevant notes. So we'll first begin with her weight gain, which is given in the case note as 10 kg over the last 5 months. Her current weight is given, and she experiences chronic constipation. Right. And BMI of 30. Over the last 5 months, she has gained 10 kgs. It's also given about her increased appetite. So let's combine within this sentence. Associated with increased appetite, she also experiences chronic constipation, for which she is on laxatives. Ms. Smith currently weighs 106 kg with a BMI of 30. That's done. And let's write about her diabetic diet. Diabetes mellitus in 2007. Okay. No allergies to food or medication. She is not allergic to food or medication. She is on a diabetic diet, as she has been living with diabetes mellitus since 2007. After that, dementia, confusion, disorientation, and about her refusal to wear dentures due to confusion and disorientation. So let's write all these things together. She is confused and disoriented since the onset of dementia. Dementia, it was last year, so which has developed over the last year. She has upper and lower dentures. However, she refuses to wear due to her confusion. And that's done. Now we will make a new paragraph to discuss about a stroke in 2018. At the same time, about a chest infection and throat clearing, which was noted last month. Right, so Ms. Smith suffered a stroke in 2018. Last month, she had chest infection, occasional cough, and consequent throat clearing when eating yogurt. I have written consequent because this happened right after the occasional cough, as it is given in the case note. So that's the reason I wrote consequent. Throat clearing sporadically, now that's not important, so I've not written that. Now, as I have to write this thing, throat clearing when eating yogurt, so I will have to put a comma before and, or else it will be misinterpreted as, or else it will be misinterpreted as she had chest infection and occasional cough when eating yogurt. That should not happen. So that's the reason why I put a comma before writing that. So I've written all the important information which is required to the dietitian. Now I will just make a final paragraph. Considering the above, it would be grateful if you could. Now I cannot repeat the same thing which is written in the introduction, but I will just elaborate it. Visit focusing on the patient's condition. Ms. Smith and assess her health condition. Your immediate intervention will be beneficial to investigate her swallowing dysfunctions and related factors. That's done. Yours faithfully. As there is no recipient's name,